Hi, I'm Dr. Gwen. I'm a clinical psychologist who's been empowering disabled individuals, their families, and their support systems for over 20 years. If you haven't already, please consider subscribing to my channel, where I curate tools, share mindsets, and promote habits to help the neurodiverse community thrive. Also, hit that notification bell so that you don't miss a thing. In this episode, it's my pleasure to welcome back Dr. Eileen Crehan, assistant professor at Tufts University. We discuss one of the top stressors for parents and caregivers of autistic and neurodiverse teens and adults: sexual abuse. Eileen and I explore why autistic individuals are more at risk for sexual abuse, discuss boundaries, consent, and assertiveness, and explore tangible ways to reduce the risk of sexual abuse. It is our hope that this information turns anxiety into practical actions that can be taken today. I hope you enjoy this very important conversation with Eileen. Hi, Eileen. Welcome back to the channel. Thanks for so much for being back.
Thanks for having me. I'm so excited to chat some more.
Yes. I think that our conversation today, or the deep dive that I want to do today, is definitely on the top of many parents' minds. You know, as I do transition assessments and helping parents really figure out what their dreams and even fears are for their adult child, one of the things that definitely tops the list is their fear and worry about potential sexual abuse.
Yeah.
And, I'm wondering if we can really get into what are some of the ways in which we can empower our families to be mindful of this.
Yeah, it's a great question. And I think that, at least with the families that I've worked with, this is, something that comes to the forefront of, a parent's mind at some point, right? Either because an event has happened or they've read about something in the news, or it's just something they're concerned about. And I think, the one, good piece of news is that there are steps we can take to help reduce risk that aren't terribly challenging, but we just have to make sure that, parents and families feel empowered to take those steps on, right? It's not something that we really get trained in how to do, or, much instruction in how to do. So I think there's some steps we can take that we can chat about.
Yeah, I think that's great, which is like to get practical and to say, hey, in our community, here are some of the things that we can do. And I really feel like having an action plan, having a plan really is one of the best antidotes to feeling anxious about something, and I think the fears and the worries are really legitimate. And so, okay, so why don't we just dive right in? If we could let's just start with what is a strategy, or what are some of the things that parents and their young adults, if we were to empower them with some skills, let's just maybe start diving into them. So out of the gate, what would you suggest is one of the things that parents and their young adults can work on now?
Yeah, I think the way I like to think about it is, I guess, the two big pieces. One, learning to talk about sexuality and bodily autonomy is like learning a new language, right? So that you have to learn the wording and how to navigate that. And then I think the other piece is that even if there's something that you're not sure how to talk about, you as a parent or a provider or whoever, you would much rather be the provider of this information than the alternative. And by the alternative, I really mean like the internet, right? There's some good information there. There's a lot of bad information. People who might want to take advantage of kids, young adults, folks who might be vulnerable to being taken advantage of. And so I think, when I see parents like, I know I need to talk about this and I just am not sure how, I hope that thought empowers them. Like, well, we want this to be you. We want you to be the go-to source of information. And so I guess jumping up from that, sometimes where I start, and this is such a psychology hat thing to do, but I'm like, let's do some self-reflection, right? What topics scare you to bring up, right? Is it because you're not sure how to talk about it? Is it you're afraid if you mention it, it will give your child ideas or put them at risk? And then oftentimes I find, starting from that point of what topics are you like, yeah, I got this, and which topics where you're a little bit nervous about it. That helps me as a provider sort of help you, right? So instead of, oh, I'm not sure how to talk to my kid about this stuff, it's like, I'm not sure how to talk to my kid about, meeting people on the internet, right? And that is a separate set of strategies than maybe, talking about other sort of sex health topics.
Yep.
Yeah, so I like to start there.
That's great. So this idea of starting with building a vocabulary about the body and about sexual functioning, like starting with that educational piece. Yeah. This really resonates with me as well, because so many of my clients struggle with their language functioning, right? So often I find myself making sure that the vocabulary that I'm using is a vocabulary or a lexicon that my client understands.
Yes.
And so, Eileen, how would you say to a parent, and that what's a good way to start with just building that lexicon, building that vocabulary? What's the best way to do that?
So I think, if there's a couple ways you can do it. A couple of my favorites. One is if you can make it into a bit of a game, right? Where you're all sort of laughing. So this is an activity I'll often do. And it's from a book that I've used. I didn't make it myself, but let's say we'll use the word breast, right? What are all the words that you know that also mean breast? And so this is uncomfortable at first, but usually results in some giggling. And the point of this is really that you're saying, okay, here's the word that we might think is sort of proper or correct, but it's not the same as the word you're seeing on the internet, right? Or hearing on the school bus. And now we've made sure that we're all speaking the same language. So when I say breast and you say boob, we're meaning the same thing. And I can't tell you how many times I've done this activity with teens, young adults, and they've had terms that are crisscrossed, right? Which happens. And that could create a lot of issues, right? If you're telling someone, I'm trying to think of like a good example. Oh, here's an example. We had, I'll change some parts of this, but a story where there was a young student who's being abused because someone was touching their cookies, right? And so she was telling people that this person was, taking their cookies, playing with their cookies, and they sort of thought, teachers thought they were sort of kidding, and it turned out that this person had taught them that the word for breast was cookies, right? And so she was not able for a while to communicate that. She was communicating it, but it wasn't able to be understood. And so creating that common language, really important. So you can do that in a fun way. And then you can also identify, if there are words that are incorrect or things are mislabeled. And I think the earlier also you can do that, right? Make it okay to say those words around the dinner table. I think too often I have a visual sometimes I use for this, but like the first time you have a conversation about some sort of sexual behavior, ideally is not when something negative has happened, because then there's a big reaction, right? People are upset, right? And it may be in a caring way, but, you tell them, oh, someone touched my penis who, maybe wasn't supposed to. For some reason, teachers are really upset. Parents are really upset. And you're like, oh my gosh, this is a thing I should not talk about. Whereas instead, if it's already, it's okay to say penis in front of your parents, if something happens, you can tell them, and at least there's a little bit less of a sort of threat of something really negative happening, or like a big deal being made out of it in a way that would be interpreted negatively, even though people are trying to help.
Yeah. And this is, I think what you're also kind of speaking to is this sometimes societal stigma of not having these conversations.
Yeah.
Or maybe there's a cultural piece to this where we're not having those conversations at the dinner table. And you're right. If something does happen and it's negative or it's serious or people are worried about it, and it's the first time we're talking about our different body parts, that's going to be challenging. That could be a barrier to having that open conversation. I love the game. That's so great. I think we would even learn, right, Eileen? Like, based on some of the terminology these days, we might even learn some other some other terms.
That's true. Like oftentimes in groups, someone will say something and be like, I'm actually not sure if that's right. Right? Like, is that what that means? So it's good generationally, culturally. It's a way just to get you all on the same page. And oftentimes, especially in my teen groups, they will know. They'll be like, yeah, that's what that means. And I'm like, well, if all 10 of you seem to agree on this, what this means, then I I trust you.
Yeah, you're like, then I don't have to like go check Urban Dictionary. Like, cool.
Exactly,
All right.
exactly.
That's
Yes.
fantastic, which I often am checking because I'm like,
Yes.
what does that mean? I
You
don't
gotta
know.
do it. Yeah.
I love that. That's a game. That's fantastic. Any other ways to help support a parent to build the vocabulary itself, like any books or movies
Yeah.
or shows or
Yeah, I think, if you're sort of intentionally having media available where this could prompt some discussion, right? So for, with most teens and young adults, if you're like, hey, we're gonna talk about sexual abuse and like right to your own body today, they're gonna go zooming out of the room, right? That's pretty age appropriate. Whereas, if there's something you're watching. So one example I oftentimes use is the show, it's called Sex Education on Netflix, which is not, autism specific, but has a really broad range of identities and sort of behaviors that are presented. It's not appropriate for really young children, but for older kids, they tend to like the show. And then you can have like, oh, let's like, what did they mean by that, right? What do you think that is? And that can also help, I think, parents to understand what their child is noticing or picking up on or finding important. So I think that can be another way to sort of get at the same topic in a different way. And I always suggest to parents, if you had really comprehensive sex education, you feel comfortable talking about bodies and sexual behaviors and identity, that is awesome. But for most of us, that was not true. And so there's a textbook that I usually recommend. It's actually called SEX, and it's lengthy for sure, but it's very digestible. It goes over everything from like body parts, like I said, to identity, attraction, and I can share the name with you for your viewers. But I tell parents, like, you're not expected to figure this all out on your own. Right? There are resources that you can consult, and then you can sort of adapt it for what your kid might need. Yeah.
Yeah, that's great. That's really great. I love that. I love kind of taking something kind of modern, like a modern show, watching it together, and then dialoguing about it. It's a very dynamic, I think, kind of, and can be something that you can do together, which is maybe going to provide enough structure for not only the child or the teen or young adult, but also their parent. Yeah. So something that you brought up as a second thing that you want to look at is that you want to ensure the source of information. So where is this information coming from? If it's not going to come from you as a parent, or maybe a trusted professional or someone in education that you respect and trust, then it's going to come from other sources, right? Yeah. And those sources may not be accurate or healthy or, which then gets related back to self-reflection for a parent, right, which is how comfortable are you with talking about sex, sex education, and abuse? How comfortable are you with these things? Do you have any suggestions for parents who didn't have the experience of having this be an open dialogue for themselves between them and their parents? Do you have any suggestions for parents that might be a little shy or uncomfortable with this topic?
For sure. And I think this is more common than uncommon, especially because when we're thinking about things like sexual abuse, right? This is like sometimes asking really specific about sexual behaviors and body parts, which is, even if you're comfortable with sex ed, is sort of like advanced level, I would say. And so I think rely on your resources. I also have, I often do a bit of like mapping with families where sex ed really suffers from this like dispersion of responsibility. Like we think or hope school will do it. We think or hope, someone else will teach it. And in reality, we get our information about sex ed, which is the big protective factor against sexual abuse, from formal and informal sources. And so that we make a plan, right? So we say, okay, someone needs to talk about boundaries. Someone needs to talk about consent. Someone needs to talk about, contraception, whatever topic, you feel like your kid is needs. And then who's going to talk about this? Sometimes parent is not the best person. It's Uncle Jimmy, right? Uncle Jimmy is the cool uncle, right? He can, for some reason, connect with my kid in ways that I can't. Or it's the school nurse, but then this writing it out helps you then be like, as a parent, being like, hey, school nurse, like, I'm pretty sure you're covering, STIs. Let's confirm that so it doesn't get missed.
Yeah.
And I think we do a lot of great planning for educational goals with kids with autism, or, at least we make plans, and we don't do that for sex ed. And then, we miss chapters that we need to be hitting. So it doesn't have to be you. I've also had I had a parent once, they had this really great system. This was a kid who was pretty verbal, pretty able to write. And they had a notebook where he could ask any question he wanted. He would write in the notebook and parent would answer, but they were not allowed to talk about it out loud. And that was a rule that the adolescent set up. So they could ask anything. And as long as they were safe, then parent stuck to that, which I thought was really nice. And it's easier, right? You have a second to sit and think. You don't have to do it on the fly. That can be really, really good. And then the last piece, and this is harder, but I think when I'm trying to have this conversation with parents and they're like, I'm really worried, but this sounds really challenging. Okay, yes, but we don't want to make it so you don't talk about it, so someone else we don't want giving that information gives it to them, like someone who's trying to take advantage of them. And sometimes this means we have to sort of walk over to that side of talking about topics like masturbation when we weren't thinking about having that conversation with our child. We don't always have to have direct conversations about that. And so I do try and tell parents, yes, it probably will be an uncomfortable conversation, right? Probably the first time you've had that conversation. But if you need to motivate yourself, it's better you than someone, they meet who's chatting them through a video game or something like that. And so to find ways to give opportunities for sort of sexual outlets that are healthy and safe, so they're not doing sneaky things to get needs met. If that seems, if that makes sense. Yeah.
Yeah. Well, it's funny because you're right. When there's a need and it's not directly met, it gets sneakily met. Yeah. And this is an area where we don't want a lot of sneaking.
Yeah, exactly. Yeah.
Right. Yeah. And I was going to say, you don't want to sneak cookies, but then, we just talked about cookies as not being cooked. So that's not maybe a good example. But it kind of lends to how complex this is. This idea, though, of, who's responsible. So, yeah, you're right. Actually, we do a lot of very explicit planning for educational goals. We do that, but we don't do it with this, right? Because in educational goals, we're like, what's the goal? What's the frequency? Who's responsible? How often are we measuring it? And you're right. Who is responsible for talking about this? Maybe what could even be helpful here for parents is if it's uncomfortable for you, what are the coping strategies or skills to work for yourself? Yeah. To be able to get to the place in which you are the source of information. Yeah. Because I think sometimes parents don't think about their own self-care in that moment. I can't get over this. So, I love that you can ask anything in this journal.
Yeah, that's a cool one. That's a really creative.
It's really cool.
Everyone wins really with that, cool. I think. Yeah.
Everybody wins. Everybody wins because, I'm thinking about my own comfort levels, and writing something would give me time to develop a response that I would feel better about. And so I think that's just such a cool and that's what I love. I love these little tips and tricks, and it's so good. Yeah. Okay. So as we're looking at reducing risk, we know that we want to be able to talk about it. We want to be able to have words, language, communication surrounding our bodies surrounding sexual functioning. We want to have good sources of information for that. What else do parents need, or what else will be helpful for parents to do or know to help minimize risk for abuse? Yeah.
So one thing, and this is, topic, I guess, but I think it's really related that we find, like when we did a survey with autistic adults and we asked them, what do you wish you had learned more about that would have sort of helped you feel like safer and like stronger relationships? And they rated learning about assertiveness and consent very, very highly. Like, I wish I had more information on this. So there are some emerging programs for this online. There's not a ton of evidence behind them yet, but this seems to be sort of a new wave in this area. So I'm optimistic. But I often say, like, the same social skills that have worked with your kids before, like maybe social stories, scripts, will work in this situation, right? So, and then just saying really straightforward, like if someone is touching anything that a bathing suit would touch, right? If you're not using particular body parts, depending on the age of the kid, then what could you say, right? Sort of in conjunction, they did this study, not with autistic folks, but with college students a few years ago, asking about how they say yes or no to sexual behaviors. And we're all taught, like, just say no. And that is the least utilized strategy of college kids when they give and receive consent, which isn't shocking, right? It's oh, I have a headache, right? Or not texting someone back or something like that. But you can see how sometimes even in the like safety information we're teaching kids, it's maybe not as applicable today when kids are interacting online, or if there are adults who are trying to prey on vulnerable kids or adults. And so I think, sort of long roundabout way of saying, talking about, hey, it's okay to say no. Here are some ways to say that, to type that. That's an okay time to lie. If you feel something's off, say, hey, I got to go home, right? And so giving permission really explicitly to kids, young adults, I think is a conversation parents can have with them, because oftentimes in autism we do a lot of compliance sort of training, quote unquote,
Yes.
right? Like, I tell you to do something and you behave. And so then at some point during adolescence, we're like, but now differentiate when you shouldn't do something on your own and figure out how to communicate that. And that, I don't have a straight answer for that. That is tough. And so it's usually like a sort of family by family discussion I'm having. But at some point around, when puberty is hitting, being like, hey, just because it's a grown up, right? You don't have to do it. And we can figure out a plan later, if you're not sure in the moment. But making that okay. Yeah.
Yeah. Making it okay to say no to an adult or someone in perceived authority, I think is such a great, it is a very important thing to think about, because you're right. So many times some of these early programs are about compliance. And now you're saying, hey, you don't have to comply with everything. And if anything, we want you to be a critical thinker.
Right.
About what you agree to or not agree to. And,
and please do all this before you have a fully formed frontal lobe, right? It's a big demand.
It's a big ask. It's a big ask. Love the idea of like, yeah, you're right. Whatever works socially, that those things could work, scripts, social stories, even role playing, could be really helpful here, and how to say no. I love that. Whatever your bathing suit covers. That's a great visual as well. That's a really, really great visual. So that's great. Okay. Assertiveness and consent. You kind of brought some of these things up. So let's talk about the promotion of advocacy, or in your mind, Eileen, assertiveness, is that different than advocacy, or is that the same?
Oh, good question. I think for me, and this is just because it was the context of the questions we were asking, we were thinking more like situationally. I think advocacy in my mind is more broad, but I think those are really close in their meaning. I think when we're thinking about sort of practical skill, I'm thinking like words to say, actions to take in the moment, in concert with another person who, it's not always like, in abuse, it's oftentimes people we know, right? So it's not always, hey, stranger danger, let me yell, no, and run away from you. You might be in a situation where yelling might feel really odd, right? So what do we do instead? But yeah, advocacy and assertiveness, I think, would be really go hand in hand.
Yeah, absolutely. I love that. Words to say, actions to take.
Yeah.
You know, for so many of our clients, things are very tangible. Things are very literal. So we want to practice those things. Like we actually want to help them practice saying words and practice the actions, you know, that how important that is. How do we talk about consent? So let's when we talk about let's talk about consent in this arena.
Yeah. And this gets extra complicated because sometimes what, a teen or young adult is like, yeah, I would be good with that. Parents are like, no, right? And so there's a little bit of, certainly you can have discussions about like family values and boundaries about what you think should and should not happen, but you got to arm the kid for what they're going to use in that moment, which can be a tough thing to sort of wrap our heads around. I think that when we're talking about avoiding abuse, right, or reducing risk of abuse, we really need to be having conversations about the positive side of that. So like with your teen, with your young adult, what do you want, right? What are your goals? Is it to date someone? Is it to, find a new friend? Is it that you're not interested in dating, but you're, having, wet dreams? And so, what do we want to do about that? Having that conversation first can be like, okay, this is what you want. Here's how we can make that happen. That way you don't have to seek out experiences, or if, dangerous adult is suggesting something else, you're not sort of interested in going to try that. And so I think sort of getting back to the consent question, deciding, talking about ahead of time, like what you're okay with and not okay with, and when and how that might change. Really complicated discussion. So you'd have to sort of tier it depending on the, communication abilities of your kiddo. But I think that is actually where you start, and then talking about how you hear consent, because that's also very important, right? And then also how you express consent or not. I think that's where I would start with that.
Yeah. And Eileen, can you expand a little bit on this? What do you mean by how you hear consent?
Yes. So here's a great example. So the peers curriculum, I'm sure you've heard of that, which is like the social skills training program. They have a 2-message rule. And the rule is that if you call someone, let's say you ask them on a date and you give them a call, they don't respond or they say no, you can ask one more time in case they were busy or, you got your wires crossed, but that is it. Okay. When I ask teens in my group, like, how many times can you ask someone out and when they say no before you should stop? And the average estimate is around 10. Okay. And that's problematic for a lot of reasons, right? And stalking is more likely when we think about autism, right? Folks on the spectrum are not more likely to commit sexual crimes, right? That is a myth that persisted for a long time that we know is not true. When they do, like any population, there are members of communities that commit sexual crimes. They're more likely to be non-assaultive. So things like stalking, flashing, things like that. And so particularly with stalking, I really believe, and I haven't tested this, but we're working on it, that the conversation we have in those groups when I'm like, not 10, 2. And that doesn't mean 2 voicemails, 2 texts, 2 messenger messages. It means 2 overall. There's a light bulb that goes off. And many of these kids are like, oh, that's lower than I thought. Okay. But I don't think we teach them that, right? I don't think we have that conversation about why it's 2 and why that's so important. So, and that's what I mean by hearing. So even though someone is saying no and we're like, oh, well, I'll just keep asking. Or maybe they're saying, I have homework. In the class, we're like, it doesn't matter what they say. If the gist of it is that they're not on a date with you, that's a no. I think that's really important.
Yeah. I mean, you're talking about social reading, which, for our population can be a little challenging. Inferring.
And we're really vague about it with like, I mean, I don't know, it's been a while since I dated as a teenager, but things were not clearly communicated, right? That is not what adolescence is known for as the time period. Yeah.
Yes, you're absolutely right. For control and good communication. Exactly. Not known for that. I love that hearing, and then maybe even dealing with hearing no? Like,
Yes.
how do we sit with the word no? Or when someone says no to us, how do we respond to that? So all of these are such good strategies, Eileen. And, we're talking a lot about what would happen in real time, like person to person. I think a lot of the audience might also be thinking, but what about protecting or reducing risk when my teen or my young adult's online?
Yes. Yeah.
And I realize that might be just another conversation that we have, because I know that is there's its own complexity.
Yes, for
But
sure.
in general, these strategies that you're giving today, those do still apply foundationally to protecting yourself online, right?
Yeah, for sure. And I think
Yeah.
I think that the extra piece that online adds, and it's tough, right? Because it changes so fast, right? The communication tools, even kids who graduated from high school 5-6 years ago, like they're new now. But I think there's the risk that I see with that is that the internet can be a really good place, right? But that there are a lot of legal problems that you can run into, accidentally or not, right? People can find vulnerable individuals much more easily. And so communicating that ahead of time, really clearly, do not ever send or receive naked pictures of yourself or anybody else, right? And then if you do get one, right, and here's who you tell, here's how you do it, because just deleting it won't necessarily fix the problem. So that way people have an outlet, because expect that something is going to come up, right? That they are going to face, people are texting naked pictures around from a group of friends or something like that, which hopefully doesn't happen, but often does. I mean, I'm sure you see this in your work where it happens and you're like, oh my gosh, this is not, what do we do now? So making a pathway to deal with some of these situations, and things like, we've talked a little bit about pornography, right? And so what are some ways to access this material? Not necessarily because we want to be like, hey, everyone, let's use porn instead of, these other relationships or things like that. But if you've got a kid who's, let's say, asking people out and hearing no a lot, and they are interested in an outlet that is not an unwanted adult, something like that, then maybe this is a good alternative to discuss. And so I think thinking about, what are the stigmas around different online sexual behaviors and how do we feel about them and where do our values lie? But also, is it possible for us to harness the power of some of these tools to prevent against abuse? Which isn't everyone's favorite way of facing some of this, but I think done sensitively can be really effective.
Yep. And it starts by providing that space, that source of information, or going back to the source, going back to a home base, making that we're talking about all of this is just normal.
Right. Yeah.
Right. It's not dirty or bad or strange or odd. Right. It's like, no, this is part of life.
Yeah.
This is a safe space to talk about it, and let's do that. And even it doesn't have to be the parent again, but there does need to, it just needs to be identified wherever it is or whatever it is, having a way to talk about it, a person to talk to, a group of people that does need to be identified. Yeah. I love what you said too. If you see a naked picture or receive one, you never send them or receive them. If that happens though, here's what you do.
Yeah.
Right? Give the plan. Yeah, give the pipeline. That's fantastic. Great. Any last ideas or thoughts about reducing the risk of abuse that we haven't covered?
What have we not sort of gotten to? I think we hit a lot of the major points. I think a big takeaway for parents, I think this is stressful, right? This is stuff that keeps parents up at night. We know that when we ask parents of autistic kids, especially for parents of girls, right? There's a lot of questions about, what do I do about pregnancy? There's a lot of questions. Like, I think we said this last time, like we could keep talking about this stuff for hours and hours. But so to seek out support from providers who can help with this. Don't feel like just because it can be maybe new to talk about that you have to take it on by yourself. That you can get support, I think is really important, and maybe a little bit of a cliche, but you don't have to go it alone. And the earlier you have these conversations, the better, right? It is easier to have a first conversation about this stuff when your kid isn't able to, shut the door and lock it on you, right? But you can still do it. If you're like, oh my gosh, I'm already at that point, that's okay. It's never too late. I really, honestly, truly believe that. And if you can have some of these conversations in a way that's sort of, serious, but also lighthearted, because it's, that makes it easier, then I think that you'll go far. Any conversation you have is better than no conversation, even if you finish it and you're like, oh my gosh, right?
Yes,
So,
even though it was completely clumsy and a mess, at least
go back and correct it.
I know. And I do think it goes a far way with an adolescent or a young adult when a parent is like, hey, let's have a conversation. It's very human, but it's like, I get it. Like I'm not completely disconnected from the moment, like I'm paying attention as a parent, and I'm here, and this isn't easy for me to talk about. And we're just going to do our best with it. That says a lot. That action, I think, goes a very far way. Eileen, thank you so much for lending your expertise here and helping this community. I really appreciate it.
Yeah, important topic. Thanks for inviting me to talk about it.
We'll have to do more. We'll come up with more, because lots to talk about.
More. Even as we're talking, like, oh my gosh, there's more.
I know. Me too. All right. Thank you.
Thank you.
Thanks for spending time with me. If you're interested in finding out more about Dr. Crehan, her information is in the description below. If you got any value from this episode, please hit that like button and subscribe to this channel. Doing so helps to get this information to others just like you. See you in the next episode.